As the winter weather closes in, seasonal illnesses are running rampant. In the last 4 weeks, NHS England reported 1 in 24 people were likely to have tested positive for coronavirus. It's why long COVID sufferers like Jez are warning of the dire effects that the infection can still have.
I think we're going to continue to see large waves of COVID. Certainly, we're seeing people getting reinfected just a number of weeks after a previous infection. So this idea of immunity that might last you a year or two is no longer applicable. And even more scarily, what we're seeing is that people who've maybe had 2 or 3 infections before and recovered no problem, on their 4th or even 5th infection developing quite debilitating long COVID symptoms.
Jez was an avid marathon runner, but after catching COVID in 2020, he's been left with severe long-term effects. Long COVID has left him unable to work for nearly 4 years.
The rest of the symptoms are incredibly debilitating, from absolutely crushing fatigue to headaches, dizziness, palpitations, shortness of breath, skin rashes, and one of the hardest is what's sometimes called brain fog.
NHS hospitals like this one have seen a growing number of patients flocking to their emergency departments with respiratory infections, including a new variant of COVID. As a result, accident and emergency wards in parts of the country have had to declare a critical incident. And now medical experts are calling for face coverings to be made mandatory once again to prevent the wider spread of infections. Just this month, the UK's Health Security Agency has recorded up to 1.9 million people in England and Scotland confirmed or suspected to have COVID. The rapid spread of this variant is leading the WHO to implement face coverings across health facilities globally. But some medics say stronger measures are needed to combat the spread.
We're not in a pandemic anymore. People think COVID is not an issue. People think flu is not an issue. But as a healthcare professional, we're seeing people coming into hospital really unwell with some of these viruses and respiratory illnesses. So really important to check if you're eligible and get those vaccinations in.
Ultimately, the advice from doctors hasn't changed. Wash your hands, keep ventilated and wear a mask. Lape Olarinoye, TRT World, London.